Scenario 6. The Emergency Department. Many emergency departments in the UK do not have a safe corridor. That is one that is segregated by automatically closing doors, and therefore eye protection and face masks should be worn at all times. This is to ensure that you are not at risk from environmental contamination of out-of-sight aerosol generating procedures such as intubation. These procedures are more likely to occur in an emergency setting, which makes correct use of PPE at all times of paramount importance. Whilst the following scenario has been filmed on a general hospital ward, the PPE procedures remain the same. Hand hygiene with alcohol gel or soap and water. Procedures inside containment areas prior to entering bay or side room. Hand hygiene before donning. Apron, surgical masks, eye protection and gloves in this order. Don plastic apron. Snapping the neck loop allows for the neck to be covered. Put on fluid-resistant surgical face mask, ensuring it is closely fitting and fully covers the nose and mouth. First, position the upper straps on the crown of your head above the ears and lower the strap at the nape. Ensure mask is flat against the cheeks. With both hands, mould the nose piece from the bridge of the nose firmly by pressing down both sides of the nose until you have a good facial fit. Place either face shield or goggles on to protect your eyes if there is a high likelihood of blood or body fluid exposure, including respiratory secretions. This is strongly recommended if contact is to be made within 1 metre of the patient's face. Put on gloves. This is the procedure for isolation bays once donned. For safe doffing instructions, see later. Before entering the bay, please ensure that you have reviewed all the relevant clinical records for each patient in the bay, as you will not be able to take any documentation, patient lists or computer equipment into the bay. Please ensure a safe distance is kept from the patient's face at all times. The end of the bed is a good measure of the appropriate distance. Ensure you have any equipment you require to hand or located in the bay and that a regular cleaning schedule is in force. Treat any equipment as contaminated unless you personally have witnessed it being cleaned appropriately. Do not spend more time than is necessary in the high-risk zone, equivalent to 1 metre of the patient's face. Ensure the patient is looking away from you at all times. Following each patient examination or care, remove gloves and wash hands with soap and water or use alcohol gel. Remove apron. Don a new set of apron and gloves. To avoid cross-contamination from mask and goggles, break neck strap and retie it. Repeat these steps after each patient encounter within the bay. Once the round in the bay is completed, remove gloves, wash hands, then remove apron and alcohol gel. Step out of room or bay and alcohol gel. Exiting the emergency department. Once your round is finished, move along the ward to the side exit door. Remove gloves. Wash hands, remove goggles or face shield if worn. Remember, outside of goggles or face shield are contaminated and should not be touched. This requires a clean assistant. Use alcohol gel to decontaminate your hands. Remove your surgical face mask. Wash your hands with soap and water or use alcohol gel sanitizer. Exit containment ward.